Little research has been done to investigate looking behavior in infants when testing in an online modality. Therefore, we chose to apply online three paradigms widely used in infant research. In the experiment 1, 20 monolingual children aged 24 months participated in a word recognition task using intermodal preferential looking. The task was adapted online with a platform Gorilla Experiment Builder. The results clearly showed that infants aged 24 months looked at a picture on screen longer when the picture was named compared to a picture that was unnamed. This is an expected outcome which indexes word recognition in children and replicates previous lab-based findings. In the experiment 2, to examine word learning, 19 monolingual children aged 17 months were tested on the switch task, which was administered online via the Zoom app. We found that the infants successfully learned the association between a new object and a new label, as indexed by the longer looking time in switch trials as compared to same trials. They were able to encode phonetic detail when learning a new word, which is consistent with previous findings. Lastly, in the experiment 3, 30 toddlers aged 19 to 26 months performed the standardized language assessment test, called the WING test, online via Zoom. Then, 30 children of the same age range did the WING test face-to-face at the University of Plymouth Baby Lab. We originally expected that the children who did the WING in the Baby Lab would outperform the online participants. However, the findings are exactly opposite to this hypothesis, as online children outperform the face-to-face group. The results of the three experiments provide support for an online testing validity, with some modification to lab-based procedures. The intermodal preferential looking and switch tasks successfully collected eye movement data and provided solid replications of established results. Experiment 3 demonstrated that children can perform well on a language assessment test administered online and that they were strongly engaged and responsive to the task. The advantages of online testing are high levels of engagement, high effect sizes, trials which are not infant-led still replicate findings in lab, and there is very little attrition or data loss. Nevertheless, online testing has some limitations. More replication studies are required. It might not be suitable for children with language delays. Coding might be time-consuming, and suitable electronic devices and internet connection are required. Recent pandemic has opened promising avenues of investigation in early language studies, and it is likely that future research will harvest the benefits of the enforced development of online experiments, reaching out to multicultural and multilingual populations around the world.